Dr. Gershman, it is so good to be here with you today.
Good to see you, Christine.
Can you tell me what it is that excites you about the CaverStem procedure?
I think it's very exciting because we can actually deliver a very good, sustainable treatment to a group of patients that really need it. Because erectile dysfunction affects not just a social relationship, like husband and wife, so other relationships, and children, and a lot of social issues, interactions. But it also affects human lives, like people with erectile dysfunction will have a higher chances of myocardial infarctions and cardiac issues and neurological issues and cancers. So I think the fact that we can actually deliver a treatment that will, be sustainable and lifetime is very important.
Can you describe a little bit more in detail what the CaverStem procedure entails?
Yes, of course. CaverStem procedure entails harvesting of bone marrow and then separating very active cells, stem cells, from this bone marrow and then re-injecting them back into the penile corpora.
So these cells come from the patient?
Yes, they are harvested from that patient and re-injected back into the same patient.
You mentioned harvest. Where do you harvest these cells from?
Yes, we harvest bone marrow from the hip or from the iliac crest, we call it. Patients in the prone position, and we harvest approximately 60 cc's of bone marrow.
Are these patients awake or asleep during this procedure?
Yes, they're completely awake. If anything, we would give them Tylenol. And then
So it's not very painful?
It's not painful at all because we use local anesthesia. We use special needles that are designed to anesthetize, and patients don't feel any pain whatsoever. And also the procedure itself takes 5 to 10 minutes.
So once you harvest this bone marrow, then you said you do some sort of processing with it?
Yes, after we harvest the bone marrow, we separate the stem cells using a special centrifuge.
Once you get your final product from that centrifuge, what is the next step?
Yes, we start with the bigger volume. We go to the smaller volume of the solution that has a very high concentration of bone marrow cells, and we re-inject them back on both sides of the corpora.
And again, not a painful procedure for the patient?
Not at all. We use a very small needles with a small gauge, so patients don't even feel that we're injecting them with the cells.
Have you seen many complications or adverse events from this procedure?
Not at all. In all our group of patients, we have not one complication. We have not heard about any complications in the clinical trials. So I would say that it's a very safe procedure.
So speaking of your patients, what is the age range of patients that you've treated so far?
Excellent question. In my group of patients that we injected, which is more than 20, it ranges from 40 years of age to 75.
40 years? That young?
40 and sometimes even younger. And the spectrum of patients is really getting bigger because we're seeing younger patients coming out with all kind of psychogenic and organic sexual dysfunction. We see much older patients in their 80s and 90s who are very active and want to be still sexually functional. So I think this paradigm of sort of narrowing the groups of patients who would be interested is not right. I mean, we actually, if anything, we see much wider range of patients that will be eligible for this procedure. And also, think about this, if you're a young patient who really have sexual dysfunction and suffering from it mentally and physically, if you put them on a drug treatment, let's say Viagra or Cialis or Levitra, we talk about lifelong symptoms treatment because it is occasional treatment. You treat the symptoms, where with CaverStem, we inject and we really rooting for a long-term effect that improves the baseline of sexual dysfunction.
Right, long-term effect without all the side effects that you can sometimes get from those medications, from what I understand.
Sounds really good, right?
Yes, sounds very good. Are there any restrictions for these patients after the procedure?
Again, no. Because we don't give any narcotics. If patients feel well, which they all did in my case, they are able to ambulate right away and go back to their normal activities right away. And we encourage them actually to be sexually active next day.
Oh, very good.
Yes.
Very good. Well, thank you so much. This is so informative, and it's just great to know
That was a
we
great
have.
discussion, Christine.
It was. It's just nice to know we have an option that's more non-invasive compared to some of the surgical options we have out there for erectile dysfunction.
Absolutely.
Thank you.